I'm here at the Orange Base Hospital about to scare the living crap out of some high school students. I'm doing a talk about my injury and my accident through the party program, Prevent Alcohol and Risk-Related Trauma in Youth. I talked to 58 high school students yesterday, and I'm not sure how many I get to talk to today, but I get to scare the living crap out of them too. So keep watching and you'll see that talk. How y'all doing? Nobody's fainted today, she told me. She said somebody fainted yesterday. First things first, I want you to raise your hand if you've ever consumed alcohol. Yep. And now I want you to raise your hand if you've ever regretted your choices or decisions after drinking alcohol. Actually, surprisingly not as many as yesterday, but I have made a lot of stupid decisions in my life. Too many to count. On New Year's Eve 2007, I was blind drunk. This was when I was 17. I was drinking at the Molong pub until they kicked me out when they found out that I was underage. And instead of being sensible and calling it a night, I took it a little bit too far. I lived around the corner from the Molong pub upstairs, and I went out onto my balcony, climbed along the railings, I walked along the roof, climbed onto the brick awning, and just did what I always did, just sat and watched people, but I was watching everybody at the pub. And then I slipped. I fell. I hit the back of my neck and my skull on the awning of the roof. I broke my neck, and the skin around my skull was ripped apart. My skull was split in 5 different places. And as I hit the butcher's roof, I broke my back and damaged my spinal cord. And I landed legs first, breaking both my legs, and then face first, broke my sternum. I broke my nose, and I only found out a couple of years ago that I did that. I didn't know it was even broken. But then I landed with this hand, flipped the hand to my arm and broke that, and it still hurts like hell. And that was when I died at 17. I don't have much memory of this night, but I can remember the panic feeling of when I slipped and when I fell. I can't remember falling. But there was a guy that I worked with at the supermarket of Molong, and he watched the whole thing, he saw it, and he held my head together. He saved my life, literally, because he held my head to stop my brain from falling out. And it took about half an hour for the ambulance to get there, and when the ambulance did get there, my heart had stopped beating, my organs had failed, and I lost 5 litres of blood. And those of you who know the anatomy, you've got 6.5 litres. And 2 litres of blood is enough to make your body go into shock, but 5 litres was enough to kill me. But then my heart was restarted with the defibrillator. I woke back up. I wasn't conscious though, my heart started beating slowly. And then I was taken to the Orange Hospital, where my heart stopped beating multiple times on the way to the Orange Hospital when I was in the ambulance. And I got to the Orange Base Hospital, and the extent of my injuries were severe. Very, very bad. And when I was stable enough at the Orange Hospital, I was airlifted by care flight to the Royal Prince Alfred Hospital in Sydney, where I was placed under an induced coma for 3 weeks, and I was in intensive care for 5 weeks. But at midnight 2007, New Year's Eve, my dad had to get a call saying that his daughter was in an accident, and he had to drive 7 hours. He was working in Victoria at the time, and he had to drive 7 hours thinking that I was dead. And I can't imagine what he was thinking when that was going through his head. But when I was in intensive care in a coma, my friends and my family, they all had to come and say goodbye. They didn't know if I was going to survive because the doctors thought the best case scenario, if I was to wake up, I would be severely brain damaged and paralysed from the neck down from my injury. And after a few weeks when I was in a coma, my brain developed a subdural hematoma, which is bleeding and swelling in the brain. Basically, the blood in my brain had nowhere to go. So to relieve the pressure in my brain, they had to drill my skull here so that the blood had somewhere to go. So at one point I had a tube coming out of my skull, and I do have photos of that, of the tube in my skull. And after 3 weeks, the doctors thought there's no way she's going to survive, and they asked my parents for permission to turn the life support off. Thankfully, they didn't. My dad had faith that I would survive, and thankfully I did. But with this consequence, still, life is life. But after 5 weeks, I was stable enough to go to surgery, where I was operated on for 7 hours, 12 hours actually, 12 hours. And because both of my legs were broken, both femurs right in the middle, they were broken to the point that the bone was actually separated. But because my legs were in traction for 5 weeks, my legs had to be rebroken to put back in place, and they had to insert titanium rods in both my legs from my knees to my hips. And I have metal plates put in the back of my neck. Only a couple of months ago got to see those, that they've been in there for 7 years and I've never actually seen them. But there's about 5 plates coming down both sides. And I got a metal plate put in my wrist, which isn't there anymore. It got removed after a while. There wasn't much that they could do with my spinal cord injury because it was already damaged. They couldn't do much about that. And I broke my back. That was another thing that they couldn't do much about. But because I broke my neck, I had a sort of like a dog collar thing, the thing that goes around your neck to keep my neck in place. Yeah, neck brace, that thing. And I have a little scar under here from that, from where the brace was sitting for like 3 or 4 weeks. And yeah, so after that and all my friends saying goodbye, thankfully they didn't have to, but I can't imagine what it was like for them to say goodbye to me. And after 5 weeks, when I was in intensive care, I was taken to the Royal Prince Alfred Hospital in Sydney, where I started my rehabilitation. I had to learn how to breathe by myself because when I was in a coma, I had a tracheostomy put in my neck. That was a tube that went from here all the way into my lungs to breathe for me. And I had to learn how to do it again. And I can remember them taking it out for a certain amount of time during the day, and I couldn't talk because with the trachea in, I couldn't say anything. But when the trachea came out, I would try and talk, and I was just talking gibberish. I knew what I was talking about, but it was sort of like a 12-year-old, or not a 12-year-old, like a toddler trying to talk. And you don't know what they're saying. I knew what I was saying, but nobody else did. And I had to learn how to use my hands again. This hand, I can't move these 2 fingers, and I don't have much use of that. My wrist, because it was broken so badly, it took me months until I could even move it just slightly. But slowly I started to get more movement in my hands, and after I think it was 7 weeks at Royal Prince Alfred, brain injury makes me repeat myself, at Royal North Shore Hospital, I was taken to the Brain Injury Rehabilitation Centre in Ryde for 3 months, and I went through rehab there, learning how to do certain things with my hands, one of them being this one. I can remember them trying to teach me this. This was really hard. to get the coordination going with my fingers because I'd forgotten all of that. My brain was damaged very, very bad. So everything that you do with your hands, everything that you do every single day, I have to learn how to do it with this hand because this hand is basically useless. So after 3 months there, I was taken to Spinal Rehabilitation Centre and had a bit of arguments with the physios and everybody there, and I just wanted to get out because it was, I think it was about eight months that I'd been in hospital at this point. And on the 9th of October, on my birthday in 2008, I left rehab in Sydney and went to the Bathurst Hospital for another 3 months. And that was just one step closer to home. And the reason why I had to stay in hospital for so long was because my dad was building a house before I had my accident, and it had to be remodified to make allowances for my wheelchair because I had to learn everything in a wheelchair. But then a week before Christmas 2008, I left the Bathurst Hospital and moved to Manildra, but that's when reality hit, and I knew I had to learn the rest of my life confined to a wheelchair because of one night. And I know that if you're having one night, you think it might not do anything. You're like, yeah, it only takes one night. And for all the girls in here and the guys as well, don't think it won't happen to you, because when I had my accident, I was pregnant, 17. All of this through alcohol, marijuana, and bad choices, bad decisions. And I have a friend who has a 5-year-old child from the pull-out method. So honestly, guys, it doesn't work. So when I was at Manildra, I was there for about a year, and then my dad died in a plane accident, and then bit of a topsy-turvy for the next couple of years, but all in all it took about 6 years after my accident for my brain to start thinking more coherently and be able to hold a conversation and remember things and keep the hand-eye coordination. And I still get distracted very easily. I get tired quickly. I run out of energy quicker than everybody else does. I don't sleep very well because of the damage to the brain, and also because I used to sleep on my side and I can't do that anymore. But because of the damage to the brain, I damaged the temporal lobe, which is, I think this is one right in the middle of the brain at the back somewhere. I think there's a few actually. That affects memory, reading and thought process. Everything that you think of, everything that you write down when you're at school, everything that you learn on a day-to-day basis is harder for me because I've sort of developed a photographic memory, but that takes a long time. And there's just certain things that I just can't remember. Like, I can remember phone numbers, I can remember birthdays, but I've had times when I've been down the street and somebody comes up to me and starts talking to me, and I can remember the face, but I can't for the life of me remember who they are, and I can't remember why I know them and where I know them from. And same with if somebody mentions a name, I can remember the name, but I can't put it to a face. And that's the signals from the brain getting sort of confused both ways. Sort of like if you're trying to start a car and the wires aren't connected properly, that's what it's like in my brain. And if there's too many people in one room talking at the same time, my brain just switches off. I've had this happen a few times where there's been, I think there was 4 people in the room at the same time. 2 people were talking and then another person was talking to me. My brain just went into overdrive and just completely switched off. And it'd be like if I was at a party and I was trying to hold a conversation with someone. It doesn't work. It's completely messed up now.
Anybody got any questions for Chloe, guys?
Yeah.
Have you touched alcohol since the accident?
I do have a confession though. After I came out of hospital, or I sort of got released from the Bathurst Hospital for my birthday, and I was at Molong and celebrating my 18th birthday, and I went back into the vodka cruises, and I did not like that feeling. I could remember that alcohol, it impairs your judgment, but it doesn't change what can happen. And I don't like who I am when I'm drunk. So my New Year's resolution 2009 was to not drink, not even think about it, and I haven't touched it since. I don't see the point, because I get more of a high from an energy drink than I do from alcohol, and I don't like me. It's not a good feeling to know that you don't like yourself, and alcohol changes who you are. Anybody else?
So guys, just commenting on that, what we've been talking about today, Chloe, is, you know, all these guys are kind of young, you know what I mean? So they're going to be experimenting with different things. Like, I'm trying to establish and try to get these kids to think, when is enough enough? You know, and I've tried to explain to them, like, you know, don't do shots at the bar because shots are lethal. And if you've got mates who are trying to make you drink all these shots, they're not very nice friends, if you ask me. And I only experienced this a couple of months ago myself when I was at a friend's 32nd birthday, and all her mates who were actually older than her were lining her up with these shots, and I thought, you guys should know better. And I said, guys, do you want to give Elise, sorry, her name is Elise as well. I said, do you want to give Elise a good night out, okay? Or are you trying to put her into a bloody coma, or worse still? Like, what is it, you know? What are you trying to achieve? And they felt really guilty when I called them on it. And Elise was like, actually, thanks, Maura. I don't want to not remember my birthday. I don't want to be vomiting. I don't want to be sick, you know? So she didn't drink any of the shots. She just continued drinking what she was having, slowly, and she had the best night ever, okay? Alright, so it's about being a good mate to your friends and actually having their back, okay? Because remember, if you hang around with idiots, okay, stupid shit's gonna happen, alright? If you hang around with a few sensible people and one of you goes a little bit nuts, grand, okay? Because you can be there to look after that mate. That's kind of my advice. I don't know, would you agree with me in that? Because where were your bloody mates that night when they were watching, when you were out walking and getting up on that wall?
I was at the pub drinking with a guy that's 20 years older than me. And I was there with him and his girlfriend, and that was my role model. Those people were my role model, and your brain isn't fully developed until you're 25. You might feel like you know everything, and I thought that I did. I knew best. My parents were wrong. Everybody else was just trying to get to me. Everybody else was wrong. They didn't know what was best for me, but I figured out now they did.
The other thing as well, guys, and I know this is kind of going off topic a bit, but if you're like 17 years of age and you've got someone who's 10 years older than you, 20 years older, wanting to hang out with you, no offense, they're fucking weird. Would you agree? Like, honestly, you think, oh, they're so cool, they're older, they're hanging out with us, you know what I mean? Like, you feel like the big man, the big woman. I know those people because I used to do the same thing, thinking I was so cool hanging out with older people. And then, now, I'm like, those guys were the biggest loser drop kicks I've ever met in my life, and they're still hanging out with young people. They can't hang around with people their own age because people their own age just don't get them, they're just weird.
Put it in comparison to this. It's if you guys were hanging out with 5-year-olds. That's the comparison to what it'd be like if you were doing the same thing. Would you do that?
They're simple, honestly.
You wouldn't do that.
So that night, did anybody see you fall?
Yes.
So guys, listen to this. So
there was Andrew. There was actually 2 Andrews that saw me fall. The man that worked at the supermarket. Ironically, I fell off a butcher's roof and a butcher saved my life, but not quite as funny as I've got a weird brain. But he saw me fall, and another guy saw me fall, and they had nightmares for months from it. And it's not the best feeling knowing that, like, if I could pay for their shrink, I would, because that's probably what they had to do, because I didn't see it, I didn't feel it, but I don't know what it's like for them.
Has anybody got it? Yeah.
Did you say you were pregnant at the time? If you don't mind me asking, like if it's a personal question, you don't have to answer it, but what happened to the baby after it?
After 5 weeks in intensive care, my body rejected it because my body was going through so much trauma at the time that it couldn't support another life in me, so it died. Thankfully it did, but I wasn't ready to be a mum at 17, but also I wasn't ready to be a quadriplegic at 17. But what can you do? Any other questions? Yeah?
When you fell, which part of your body hit the ground first?
My legs. Snap. Yeah.
What's your greatest achievement since then? What's something you've really been proud of yourself for getting done and doing?
Talking on YouTube. The only reason I didn't come in here shit scared like I did last year when I did the same thing was because I've been talking on YouTube for about a year and telling them about my accident and about things that I have trouble with, but I've also helped people as well. I've helped one guy with cerebral palsy. I showed YouTube how I can put contact lenses in using these 2 fingers and only that, and I know it's not a big thing, I'm not getting money from it, but I know that I've helped people from it, so that's the only reason.
Another random question, what's your name on YouTube?
Clover Rose. CLOVER Rose.
Thank you.
Yeah?
Do you have a job?
Do I have a job? No. I did last year, but I quit because, long story, somebody had a stick lodged somewhere that needed to be removed, so I just said, no, I'm not putting up with that anymore.
What was your job?
I was working at a, you know where the phone accessories place is in the city centre near the kebab shop? I was working in there. Boring job, but it was a job nonetheless, and it helped pay for when I went to New Zealand a couple of years ago on a holiday. Yeah.
So someone had a stick lodged somewhere.
Not the literal.
It was just a metaphorical thing. Yeah, they had a stick lodged up somewhere that needed to. Yep.
Oh yeah.
Somewhere where the sun don't shine.
Oh yeah.
Any other sensible questions? Any other questions, guys?
Keeping in mind that I've been asked a lot of weird questions that people think sounds weird, but I know what you mean. So if you
Chloe, did you tell them how long it takes you to get ready on a daily basis?
I get up at 8 o'clock every morning. My carers have to get me up, and after I get up, go to the toilet, have a shower, get ready. I can't dress myself. My carers have to do it for me. After I'm up and ready, it's about 11 o'clock in the morning, and it's not until about 1 o'clock that I'm ready for the day, and I go to bed at 8:30 every night. That's my day, every single day.
How do you pass urine?
I have a catheter and a leg bag because I can't get up and go to the toilet.
Where does a catheter go in?
Catheter goes in my belly just above where the pubic hair line starts. It sits this far inside my belly. It's about the size of the thickness of my finger, and it has a balloon inside about this big.
And how do you go for number 2?
Number 2, my bowels don't work after a spinal cord injury, so I need to use an enema every day, which is a suppository that goes up the bum and it stimulates the bowels to make it work.
What happens if you didn't give yourself the suppository?
I could go into, I could get into a lot of trouble because with the spinal cord injury, there's a thing called autonomic dysreflexia, which means that if my blood pressure goes too high for too long, it can kill me. It can give me a heart attack, a stroke, or kill me. And if I don't go to the toilet, that can happen. I can get sick, and
So that can cause your blood pressure to go up, or
Yep.
if you have, say, sit on something that you don't know is there, it could cause pain. Chloe mightn't feel it, okay, but it could cause pain, and that will cause this autonomic dysreflexia, increases the blood pressure, and she could stroke out.
I've only ever had this twice before, And what I have to use for that is a spray that goes under my tongue, and it tastes horrible, and it opens up the blood vessels in my brain. And if you can think of the worst migraine or headache, or if someone's ever smacked you in the head, imagine that, but multiply it 1,000,000 times. That's what it feels like for your blood vessels in your brain to... Not the best feeling, it hurts like hell. But I've got a headache 24/7 because of my brain injury, because it's like as somebody that has an amputated leg that gets an itchy foot. It's not there, but the feeling is still there, and because of the brain injury, my head just plays tricks on me, and I might get a sore back or a sore arm or a sore leg or a ache somewhere in my body, but it's not real. It's not there, but I can feel it. It feels exactly the same as if it was actually there, and that's what the signals do to my brain, because I've been damaged so bad that they get trapped halfway.
So where do you feel it? Like if you've got a sore leg?
If I've got a sore leg, I'll feel it in my leg. If I've got a sore back, I'll feel it in my back. But sometimes one time I've had a headache and my arm hurt, but it was my neck that was sore. So the signals are getting stuck.
Crossword.
Yep, they don't go all the way through. Yeah?
Do you do like a physical activity, like try to go to the gym or something like that?
Yeah, I go to the gym 5 days a week. I work on my upper body and work on what I can to keep fit and active. Yeah?
Are you able to dream?
Sorry?
Are you able to dream when you sleep?
I have some weird dreams. I'm not going to get into all of them. Yeah.
Next question.
Wipe the smuck off your face. But no, I dream. I dream that I'm walking sometimes, and that's a little bit of a reality hit when I do wake up and I realise it's not real, but that's the brain. Yeah.
If you could go back to that night that your accident did happen, would you think about where you are now? Would you think about not drinking when you were back before your accident happened, when you were out?
If I could rewind, I wouldn't do the same thing. I would have finished school. I dropped out of school when I was in year 10. I didn't finish year 10. I don't have a full education. I would have fixed it. I wouldn't have done the same thing. Yeah?
If you say you woke up tomorrow and you could walk and stuff again, what would you do? Like what would you choose to do?
I would do this. I would do exactly what I'm doing now, because I would still have that story and I would still be able to help people. So I'd do this. Anyone?
Do you have
any hobbies?
Hobbies, YouTube, arts and crafts, and videoing my cat for YouTube. My cat's funny. Anybody else?
How many carers do you have?
I have two main carers. One carer works Tuesday, Thursday and every second weekend, and the other one works Monday, Wednesday, Friday every second weekend. And I have another carer that just fills in.
Guys, don't be rude. Chloe's still talking, alright? Just don't shuffle too much and don't whisper, okay? Sorry, Chloe.
I can yell. I can talk pretty loud if you really want me to.
Is there any other questions for Chloe? One more. Last one.
Do I live by myself? Yeah. Thankfully, because I'm not a people person. I would rather just speak to my cat and my goldfish. And YouTube. YouTube.
Are you living in the house that your dad made?
Sorry?
Are you living in the house that your dad made?
Oh no, that was out at Manildra. I don't live there anymore. That house got sold.
Guys, can we all thank Chloe, please, for coming? Chloe's an absolute inspiration to me, okay, and my colleagues, I can tell you that much, and I hope to God you remember Chloe's story, okay, especially when you see a drunk friend, try to look after them, alright, that's all we ask. Thank you very much, Chloe. Now guys, I've given you those forms remember your number, put your number in, okay? Don't give me a form back with no number. If I've given you a pen, if you found a pen, leave it on your chair because I need them for the Bathurst programme tomorrow, okay?
I can see. Am I going to be on YouTube?
So thank you very much, Chloe. I want to thank your teachers for bringing you guys, because obviously your teachers are pretty dedicated and passionate about trying to educate you in more ways than at school, okay? They're trying to educate you in life. My top tips is go and have fun. As I said, guys, just look after your mates, okay? And think more sensibly. If you've got pens, leave them behind in your chair and I'll collect them afterwards.
All right, thanks guys. I'd like to thank you for your behaviour today and your engagement. You're really good and participating. Big round of applause for Lisa and Laura. And another one for Chloe. Thank you very much. So we will talk about this, not when we get back straight away, but I do have a seminar booked for you for Friday morning with the Commonwealth Bank. Before we get started on that on Friday morning, we're going to talk about this.